The Dow fell more than 150 points. It was early in the session, and it has clawed its way back. The VIX, of course, the measure of volatility, is at 5%. It's now just up at nearly 3% over Delta. Travel stocks hit badly. US airlines and the majors are all lower, or roughly about the same amount, which shows what they're thinking about, along with the hotels and the hotel bookings and the engines. Expedia booking the trend. They're just up a tad or two on its own factors. Oil prices also under pressure. West Texas Intermediate is coming off its worst week since October. It pulled itself into the green after spending most of the day down, but let's not be fooled, it is sharply lower overall. The Economist's fear is that COVID outbreaks in China could lead to more lockdowns and more pressures on strained supply. The US has recently been averaging 100,000 new cases a day. And if you look at that, it's a discouraging trend. Michael Osterholm is the director of the Center for Infectious Disease Research and Policy at the University of Minnesota. It is good to see you, sir. Now, look, the reality is 100,000 deaths have gone up and hospitalizations have gone up. Same in Britain, same elsewhere, but nowhere near the same numbers that we would have seen before. So why are we not just in a flu-like situation where there will be new cases? Some people will get sick, but most people won't.
Well, you characterize that partially correct, but there are some additions you need to be aware of. First of all, yes, you're right. Case numbers, while climbing, are below that of the surge we saw in the winter here in the United States this past January, February, as well as what was seen in the UK in December, January. And it's true that the number of hospitalizations have been reduced, as well as particularly the deaths. But if you look at what's happening in the United States, for example, these cases are just continuing to climb higher and higher. And we have healthcare systems throughout the United States, particularly in the southern Sunbelt states, that are literally overloaded. They can't take any more patients. And so that's been the big challenge. If you want to put this into perspective, Richard, this past week, if Louisiana and Florida, two states in the United States, were actually independent countries, they would have had the number 1 and number 2 rates of COVID infections in the world.
The governor of Louisiana, the governor of Louisiana seems to care more about it than the governor of Florida in the way it's been handled. But to simplify this, is Delta the reason? And I hear there's something else coming behind Delta.
Well, Delta is the reason. Clearly, in the United States, we do enjoy an increased rate of vaccination compared to many countries in the world, not as high as in the UK or Israel, but you can still see the damage that this is doing. It's substantial. It's real. Right. Even with kids, we're seeing our pediatric hospitals in the southern Sunbelt states literally overrun with cases of COVID, including intensive care. So this has been the challenge. And the big question is, what's going to happen over the course of the next 4 to 8 weeks? Will we see other states in the United States become hotspots like we're seeing in the southern Sunbelt states? Or will, in fact, they have increases, but not nearly as high as the Sunbelt states? And we can't answer that. I can just tell you that there are 90 million Americans right now who could be vaccinated who have not had any vaccine at all. That's a lot of people for this virus to attack yet, and it will.
Okay, so our viewers, our dear viewer watching around the world will say, okay, this is all good stuff from Michael, but 90 million who won't get vaccinated for whatever reason, either hesitancy, never vaxxers, won't vax, wait for authorization, whatever. They don't want a max mandate because it's their right to have children in school without that. They don't want a vaccine mandate because it's their right not to be vaccinated. So one can't help saying, and I don't say this with pleasure or glee, the US is the author of its own misfortune, although states are in some cases.
They are. And it's true, though, that this is actually being seen around the world. You can see in the EU an increasing number of people who are resisting the mandates and feel that they somehow, as an individual, can make their own decisions about their health, which is true, but they forget that they're also part of a community where they result in transmission of the virus to others when they get infected. We have 12 million Americans right now who are immune suppressed or have some form of immune deficiencies, no fault of their own. And these people are yet likely highly vulnerable. The vaccines and the 2-dose regimen have provided a limited amount of protection, but not that high. So, we're trying to protect as many people as we possibly can. Getting vaccinated right now not only protects the individual, their family, their friends, their colleagues, but it helps in the community tremendously.
Michael, what's coming after Delta? I hear there are some other variants of which we are concerned, and that it is really, I mean, as you'll have been reading, the views of many experts that say it's just a time before a variant that is vaccine resistant comes along.
Well, it is true. We will continue to see variants. That's the reality of microbial evolution, that every time this virus reproduces itself somewhere in the world, it potentially undergoes changes that would result in a different virus in terms of, can it cause more severe disease? Is it more transmissible? Or can it escape the immune protection of vaccine or natural infection? You know, Delta is a bad bug. It surely is highly transmissible. If one is going to be more transmissible, it's going to have to beat Delta out. That is a frightening proposition. In terms of whether or not there is a immune escape or the ability for the virus to actually not be protected from that virus by vaccine or natural infection is still, I can't say hypothetical. It surely could happen, but at this point we haven't seen evidence of that. I think these vaccines are generally working pretty good.
Provided you take them, which of course
That's
is
right.
the crucial point. Michael, it is good to have you, sir. I'm grateful you've taken time.
Thank you.
Thank you, sir. Thank you.